gather all materials needed, check each medication order against the original positions ordered according to agency protocol. Clarify any inconsistencies, check the patient chart for allergies. Note the action special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Prepare medication for one patient at a time. Read the medication administration record or the MAR and select the proper medication from the patient's medication drawer or unit stock. Compare the label with the MAR, check the expiration date, and perform calculus if necessary. If necessary, withdraw the medication from an ampule or vial as described in the previous skills. When all medications for one patient have been prepared, recheck the label with the MAR before taking them to the patient. Lock the medication cart before leaving it. Transport medication to the patient's bedside carefully and always keep the medication inside. Ensure that the patient receives the medication at the correct time. Identify the patient. Usually the patient should be identified through checking the name and identification number on the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with the staff member who knows the patient for the second source. Close the door to the room or pull the bedside curtain. Complete necessary assessment. Before administering medication, check allergy bracelet or ask patient about allergies. Explain the purpose of the medication to the patient. Perform hand hygiene. Put on gloves. Select an appropriate administration site. Assist the patient to the appropriate position for the site chosen. Drape as needed to expose only the area site to be used. Identify the appropriate landmarks for the site chosen. Clean the site with an antibacterial, antimicrobial swab while wiping with a firm circular motion and moving outward from the injection site. Allow the skin to dry. dry. Remove the needle cup with the non-dominant hand by pulling it straight off. Rubs and bunch the area surrounding the injection site or spread the skin taut at the site. Hold the syringe in the dominant hand between the thumb and forefinger. Inject the needle quickly at a 45 to 90 degree angle. After the needle is in place, release the tissue. If you have a large skin fold, pinch up. Ensure that the needle stays in place as the skin is released. Immediately move your dominant hand to steady the lower end of the plunger. Avoid moving the syringe. Inject the medication slowly at a rate of 10 seconds per milliliter. Using a gauze spear, apply gentle pressure to the site after the needle is withdrawn. Do not massage the site. Do not pick up the used needle. Engage the safety shield or needle guard if present. Discard the needle and syringe in the appropriate receptacle. Assist the patient to a position of comfort. Remove gloves and dispose of them properly and perform hand hygiene. Evaluate the response of the patient to the medication within an appropriate time frame for the medication. And then document the procedure to the patient chart.